What's up, Hoopers? Did you recently have an ACL reconstruction and you're struggling to get your knee extended? Or do you know somebody that just went through it and they're also struggling to try and get that knee completely straight? This is a vital part of ACL reconstruction, and it's something that you need to achieve to be able to get your rehab going and moving in the right direction. So in this video, we're going to give you a couple exercises that we like using to help getting your knee straight. What's up, guys? My name is Gabe Ignacio, Doctor of Physical Therapy, board certified orthopedic specialist, and co-founder of the Basketball Doctors. Our goal here is to help poopers play as healthy as they can, keep themselves pain-free, rehab from injuries, and perform their best. This is not medical advice, it's just for educational purposes only. If you need medical advice, please reach out to your local healthcare provider. Reach out to us to see if we can help you. With ACL reconstruction, getting that knee straight is so vital to your rehab, because it allows your one to let you walk the way you need to be walking, along with quad activation. We'll get into that in a future video, but it allows you to get that knee in a position so that things can fire a little bit better, get you moving properly, and also break up some of that tissue and swelling that's deep stuck in that joint after the ACL reconstruction. So what we're going to do in this video is we're going to go over some of our top exercises that we like using with our clients to help to get their knee straight. And you can do this at home. It doesn't really require much equipment, but the big thing about this is that you need to be really consistent with this and do this every day, multiple times a day, to achieve that knee extension. From all the surgeons that we've talked to and from our clinical experience, that knee extension is pretty much number one goal in rehab, obviously besides pain and swelling management, but that all goes hand in hand with getting that knee straight. So we're getting into the videos right now. Okay, so we're going to go over the exercise to help get your knee straight following an ACL reconstruction. First, what we're going to do is warm up the tissue. So we're going to either use a foam roller or a massage gun. If you have both, great. If you have one or the other, just use that. First, big thing is we're going to warm up the calf and the hamstring. They both cross the knee joint, and that'll help get your knee straight. So we're going to use a foam roller first. We're going to lay on our back. Obviously, you do what you can with your reconstructed knee, but first I'm just going to roll up and down kind of at the bulk of my calf, going forward and back. You can pump your ankle as well, really just trying to get that tissue warm. If you want a little bit more pressure, you can cross your leg over and move up and down. If you can, you could also get your butt off the table to put even more pressure, rolling throughout that area. And same thing, you're just going to roll it up higher past your knee joint towards your hamstring, and then same thing, just roll back and forth. Find those tight areas both inside and outside. Cross your leg over if you want a little bit more pressure. Get your butt off the ground if you want to do that as well. If you have the luxury of having a massage gun, you could grab that now. I have the Hypervolt here. I'm going to go at setting 2. And then for demonstration purposes, I'm just going to show you here. You can get into your calf first, kind of rolling all throughout the muscle. We chose a higher setting just because it'll activate the muscle more and warm up the tissue a little bit more than the first setting, which is more to down-regulate the muscles and get it to relax. Just because we're going to do an exercise at the end to help get the muscles activated to help keep your knee straight after gaining more range of motion. Okay, so that was the calf, and then if you want to get a little bit higher, you can get into your hamstring that way. Okay, so after you get the tissue warm, we're going to get into a little bit of a stretching. So I have a strength band here. You could use a towel, you could use a yoga strap, whatever works for you. You could use a belt as well. You can either sit up or lay back, whatever is more comfortable and allows you to relax. So we're going to wrap it around the toe there, and we're going to focus more on the gastrocnemius. It's the muscle that crosses the knee joint. So you want to keep our leg as straight as you can. Obviously, if you don't have your knee straight, it could be a little bit, but as straight as you can comfortably. And from there, you're going to pull your toe up towards your head so you feel a nice stretch into your calf there. And for timing purposes, we want at least 60 seconds of total stretch time. You could break that up however you need to, whether it be 2 or 3 sets, but make sure you get full 60 seconds. So that's the calf there. And to get your hamstring, you're gonna lay back, use the same tool or device. You could go soft knee bend or whatever is more comfortable for you, and pull straight up till you feel a nice little stretch in through your hamstring belly or a little bit into the tendons. If you feel any like calf or bottom of your foot like stretching or numbing, try and take the load off your toe and just pull more toward at the heel. So for example, we don't want to let your toe and pull your toes back towards your head as well. Can put some nerve tension, so you want it more towards like the ball or heel to keep that toe relaxed. Should feel mostly at your hamstring and at the back of the knee if anything. Okay, so after you do that, now we're going to work a little bit more on what we call kind of like the creeping effect of the posterior structures of the knee, or kind of like the capsule and connective tissue. So what we're going to do is just a nice little heel prop. I'm going to use my foam roller here. You could also use some pillows, some books. What we essentially want to achieve is that when you lay back, your knee has some space below it so that gravity can do its work. And what you're essentially going to do is lay back and relax. And for many of you who have ACL reconstruction, you know this is not the most comfortable position, and it starts to ache and get really uncomfortable the longer you hold it, but unfortunately you need to do this. So you can work your way up. If 30 seconds or a minute is all you can handle, that's fine. Just work your way up into getting longer and longer. Eventually want you to be able to sit in this position for 10 minutes, 15 minutes, 20 minutes, and as you get better and better, then you could add weight on top of your knee, like an ankle weight or like some books or something, or you could do it while you're icing to allow more gravity to get that knee straight. After you do that, you have some new range of motion, which is fantastic. Next thing you want to do is now use that range of motion. So what we like doing is just doing some simple quad sets. So whatever knee range of motion you have, you could put a towel underneath your knee, or just leave it completely open depending on what you're comfortable with. And then from there going into some quad sets. So trying to really squeeze and activate that quad to get that knee straight and use that new available range of motion that you just achieved with all the stuff that you just did. So squeezing, you can even use your fingers or your hands to give you like a little cue to get your quad to fire. You could go at that VMO area, quad, upper quad, just whatever you can do to get that quad firing and get that knee as straight as possible. Try those out. All right, I hope you enjoyed those couple exercises that we've given you guys. If you found that valuable, or you feel like someone else can gain some insight onto this and incorporate this into their rehab, please share, subscribe, like, help us reach more hoopers. Again, we are the Basketball Doctors. Let's ball for life.